Browning Claytor is a primary care office located off Madison Avenue in Grand Rapids. Join us today to talk about Browning Claytor and the work that their office is doing to vaccinate the community is Spencer Riva, physician assistant. Good morning, Spencer.
Good morning. Thank you for having me.
It's our absolute pleasure. So go ahead and tell us a little bit about yourself and even the work that you do.
Well, my name is Spencer. I'm one of the physician assistants here at Browning Claytor Health Center. I've been here for about 4 years, and I love to serve people. I believe that every person has value, no matter what their ethnicity is or where they come from. And so here at Browning Claytor, we see all types of different patients. And one thing that I cherish and appreciate about our clinic here at Browning Claytor is we really live up to what I think is the mission statement of Mercy Health, which is that we serve in the spirit of the gospel as a compassionate and transforming healing presence within the community. And I think that's a really powerful statement, and it's something that we really cherish and do a good job here. I'm also proficient in Spanish, so I do speak advanced Spanish. And so we see a lot of the Latino community here at Browning Claytor. And something that we want to do is we want to see patients. So we want people to come in here and see us.
Well, let's go ahead and talk about those services that Browning Claytor provides for those patients.
Yeah, so we're a family medicine clinic here at Browning Claytor. We see everybody from newborns all the way up to geriatrics. We have some unique services here regarding a lab. So we have the ability to draw blood work here. We even have a colleague that is her title I have written down is a community health well-being colleague. So basically what she does is she assists patients with finding affordable medications, transportation, even housing and medical insurance. 2020 has been a really rough year. It was a rough year for a lot of people. And there are people in the community right now that need help finding affordable medications, even healthcare insurance. And so we hear that and we understand that, and we have people here to help with that. We're in the midst of trying to find a social worker as well, just again to help with some of these aspects that definitely impact our health. And we also are trying to expand our pediatric care population. We love kids. We want to see kids. And we're trying to have an initiative right now where we can do better neurodevelopmental screening. So just kind of a fancy way of just screening for underlying conditions, whether that's speech therapy or trouble swallowing in infants, or just assessing their motor skills. We're really trying to catch things at a young age for our pediatric population. And so that's been on our hearts lately. And we're just really trying to grow that pediatric population here at Browning Claytor.
And why is it so important for people to see a primary care provider throughout their entire life?
That's a great question. It's super important to establish care with a primary care provider, whether that's a doctor, a physician assistant, a nurse practitioner, for disease prevention. So disease prevention is essentially trying to prevent diseases from happening inside the body or to the body. So we're talking about everything from skin cancer to cardiovascular disease. So screening for diabetes, high blood pressure, strokes, cancers. With medicine nowadays, we have a lot of advancements and we can screen for a lot of these conditions. And sometimes, and this is no way to try to scare the population, but some of these diseases, you can't feel. You feel okay, but there's actually something going on inside. And so when you see a primary care provider, our job is at least on a yearly basis to screen for some of these things and basically just to make sure that your healthcare is up to date. So very important, and I highly recommend that you do establish care with a PCP.
And then how is Browning Claytor working to help vaccinate the community right now?
So we've been blessed here at Browning Claytor. We've received several grants from the government, up to over 1,000 vaccines that we've already given from vaccines that we had been given by the government to vaccinate the Madison Square population. The area that our clinic's in is called Madison Square, and they have been disproportionately affected by COVID-19. And so the initiative is to get people vaccinated in the community. And so we now have an embedded vaccinator here on site at Browning Claytor where we're vaccinating people. And so I think it's so important that we do get people vaccinated and that we give them good information. So that's a service that we're offering here.
And then finally today, what would you say to individuals in the African American and the Latinx community that really are still hesitant to get that vaccine?
Yeah, so I always want to be very careful when I'm trying to speak for or to a people group. And so, from my experience, I serve a lot of patients in the African American and the Latino populations. Um, I see a lot of diseases like diabetes, high blood pressure, and obesity that can put people at risk for severe complications for COVID. I've unfortunately seen it happen. And so I would like to share with them that a vaccine can and hopefully prevent some of these severe complications from happening. And this stuff's confusing, right? Like an mRNA, like what is an mRNA? What is a cell? What is this technology that we're using? What's this big push from healthcare workers and from the government to get this new vaccine? Some legitimate questions, right? And so one thing that I really appreciate at Browning Claytor is that we have a really good rapport with our patients and we listen. Again, I say that we listen to patients and we make a really safe atmosphere for patients to be able to ask some of these honest, raw questions. And we love having these conversations and being able to educate people and just give them some of the answers that they're trying to look for online. So I recommend getting the vaccine. I've gotten the vaccine. I've had family members and friends get it. So again, please come and see us. We would love to answer more questions that you have regarding your health or the COVID vaccine.
Well, thank you for all that you do for the community and especially for those who are most vulnerable.
My pleasure. Thank you for having me.
Absolutely. To make an appointment with Spencer or any of the Browning Claytor team, please call 616-685-8300 or you can visit mercyhealth.com/Browning Claytor.